Hi, everybody. My name is Kim. I'm going to be talking to you about the pandemic through the perspective of a healthcare worker. So first of all, I want to tell you a little bit about what I do. I work as a Spanish medical interpreter. What this means is that I facilitate communication between Spanish-speaking patients and English-speaking providers. I work at Kaiser Permanente and at Children's Hospital in Oakland. So I believe that we have all been shocked by the disastrous response to the coronavirus pandemic by the US government at every level, starting with the lack of testing, then the reluctance to use tests that were already developed by the WHO, and finally, their inability to produce tests and get results at the necessary speed. Then we have the horrors being faced by the healthcare workers every day due to lack of personal protective equipment, or PPE. But perhaps the most criminal aspect of this crisis is the millions of people that have been left to fend for themselves because they do not have any health insurance. The way that this healthcare system is set up makes it incapable of responding to an emergency such as this pandemic. But this is because we do not have a healthcare system, but a wealth care system that prioritizes profits over people's lives. It postpones the production of life-saving drugs and refuses to insure people unless the pharmaceutical companies and insurance companies can profit. But this isn't new. This is just healthcare under capitalism. I'll give you just one other example to show this system's complete disregard for human life. A way of treating and preventing the spread of HIV has existed since 1996. Yet, there are still 150,000 people in this country who are currently infected with the disease, and they do not know that they have it. How can this be? Well, in order to be able to stop something, you have to know that it exists. To make this possible would require every single person in the United States to be tested for HIV, and then to ensure that those who are positive are receiving treatment. But there is no public healthcare system in place to test the population, and people in extreme poverty are struggling every day to get treatment. So stopping diseases like HIV and coronavirus is possible, but it can only be done if we have a system that prioritizes people's health, which we don't. It really shouldn't come as a surprise to us that the response to COVID has been so pathetic. This is a healthcare system that has been systematically underfunded and cut back, with facilities closed and staffing and understaffing that has been chronic, and people have been suffering from it for years. If we want to defend our health and our lives and the health of our patients, we, the workers, are the ones who will have to come together and organize to make this happen. Sadly, many unions have been either silent or plain out complicit with management's decisions, which means we are the ones who will have to stand up to management and insist that we get adequate PPE, that we are tested, and that we are not pushed to work if we're feeling sick or if we feel unsafe. And so you might ask, where do we start? I'll tell you briefly what people have done at the two sites that I work during this pandemic. So soon after the shelter in place was ordered, my coworkers requested that management allow them to work from home. The way we work requires us to go from clinic to clinic, unit to unit, interpreting between provider and patient. And we saw just how dangerous the situation was becoming for us in the hospitals and clinics without enough PPE. We believed very strongly that we could still perform our duties and support our patients while working from home. Of course, at first there was some resistance. This would require a lot of technological adaptation, but my coworkers were not willing to let this stop them. They took matters into their own hands and organized everything to be able to work from home and be safe, which for them was a huge relief. Even though people were allowed to work from home, they still haven't stopped discussing all of the other important aspects of our work. One big concern that we have is if the administration will try to phase us out and have us continue to work from home after the pandemic is over. For many years, we have been fighting to ensure that in-person interpreting is available when needed. And given the drive for automation, most bosses would prefer to have us working behind a computer. So an important question is, how do we prevent this from happening? Another concern for the few of us who still have to come into work and be there in person is to make sure that we receive proper protection from infection and that we are all tested. All of these questions have provided opportunities for us to come together and discuss how to achieve our goals together. We do this by having active conversations at work, over the phone, and through Zoom meetings. What we are able to do relies heavily on the relationships that we have with each other. This has meant opening up spaces to talk, to have a drink, and to commiserate about what we are all going through. Very much like everybody else, I have been deeply disturbed by this crisis. But I have been equally encouraged by the fact that people are not just sitting back and letting things happen to them. I have seen people step up and take responsibility to make sure that not just their own safety is protected, but that of other coworkers as well. I have seen people step out of their comfort zone and speak up for what they believe is right. And I have seen healthcare workers fighting for the rights of their patients, their families, as well as their own lives. What has begun in this crisis period because of the need to defend ourselves can and must be the way that we continue to organize and fight in the future.
Hi everyone, my name's Jose. I work for the East Bay Municipal Utility District, or EBMUD, which is the local water district here in the East Bay. Thank you for inviting me for this presentation and discussion. I just want to begin by saying a few facts about East Bay MUD for those of you who are unfamiliar with it. So EBMUD provides water service to about 1.4 million customers in Alameda as well as Contra Costa County. It also provides wastewater service to about 2,000 people and maintains over 4,000 miles of pipeline, as well as several treatment plants, watersheds, reservoirs throughout the East Bay. I work in the admin building, which is located in downtown Oakland, and it has about 1,000 employees there. And the response in my workplace has been very similar to what's happened in other workplaces across the country. Early on, like we saw at the national level as well as the global scale, there was a real lack or a slow response in addressing the crisis early on. Even with systems and procedures in place to supposedly deal with events like this, the district really failed in adequately preparing for it. Things like having telecommuting capabilities had to be hurriedly set up during the first week of the shelter in place order. And during this time, instead of sending everyone home to self-quarantine, they still had us coming in, which really showed their lack of urgency in really dealing with this crisis early on. They also failed to take action across the district as a whole. Decisions were left to be made by heads of departments or even individual work groups. These decisions shouldn't have been left to be made up by management because they are not trained medical or disease control experts. Orders should have been given to send as many people home as soon as possible, as was being advised by many medical experts. But none of this took place. The district apparently also never developed a list of essential positions and tasks as part of its disaster plan. They said they were going to develop one as soon as possible, but we still haven't received one. And so we still have people going in to perform non-essential work who are only exposing themselves to the possibility of infection as well as others, especially since we've already had our first confirmed case a little over a week ago, and there's talks now that there might be a second one, but the district hasn't confirmed that. And like many other workplaces, we're also experiencing a shortage of PPE or personal protective equipment. The district is actually asking people not to use district-provided N95 masks if their immediate job duties don't require it, and are also advising people to reuse their masks if they happen to have one. But really going anywhere without the proper PPE, regardless of the type of work that you do, is not safe for anyone right now. And really the district is not really recognizing that. And for those of us that are really thinking about requesting a mask to use at work, they're actually asking us to first get our supervisor's approval, um, which is weird because now we need permission basically to look after our own health and safety. The district also continues to fall short in looking after the well-being of its employees. Work rotation programs, for example, which are intended to limit the number of people that are working together at the same time, they're either being canceled or they're being changed so that more people are reporting to work instead of less. Um, and this week, the district started implementing what they call self-symptom checks, where they're basically asking people to self-diagnose whether they're sick or not. But this makes no sense because we are not trained doctors or nurses to be able to do that, and nor do we have the equipment or supplies to do so. Not to mention that a lot of people with COVID-19, they don't even show symptoms. So how do we really know who's sick and who isn't? The only way to really know if someone is sick is to get them tested. And a lot of people at work have been asking if all district employees, especially those that do the most essential duties, will be tested, but the district really hasn't responded to that. And so, what's going to happen if some of these workers who are essential get sick? Who will replace them? Because a lot of them, like plumbers, operators, system analysts, and others, they perform very skilled work that can't just be picked up by anybody. So if they go down, they're taking the whole district down with them, and the district is either not realizing that or they're ignoring it. The lack of communication has also been an issue. We get emails now and then about how the district is handling things, but they tend to be towards the end of the workday or even towards the weekend when people are off the clock, which really doesn't give us up-to-date information when we need it. Our unions haven't been as responsive either. They mostly send out surveys, like requesting feedback from folks, which is an okay first step, but they really haven't been pushing to get people organized and to try to take action against these unsafe working conditions. In lieu of this, some of us at work from like various departments have been trying to connect with each other like on a regular basis, just to try to discuss our situation. Whether it's through the group chats, emails, or even a Zoom happy hour. People are really using this time to analyze what's happening, not just at our workplaces, but around the world, and what we really need to do to protect ourselves and everyone around us. And more importantly, I think people are beginning to see how our workplaces and society in general are set up more for production and profit than they are for meeting the needs of the people that actually run our workplaces. That's the problem. That's what needs to change if we really want to be able to deal with events like this and many other problems that we're currently facing.
So my name is Axel. I work at BART. It's a public transit agency in the San Francisco Bay Area. The system's 112 miles run through 48 stations. It's one of the most efficient ways to get from city to city. Average daily ridership was 411,000, but in the wake of shelter-in-place orders, ridership dropped by nearly 95%. There are still 20,500 people riding BART daily. Some of those people don't have anywhere else to go and use the system for shelter, but most are classified as essential workers. Since trains are running, the system needs maintenance, cleaning, and lots of other work. Many of its 3,600 employees are considered essential and have continued to come to work. BART is spread out across 5 counties, so getting together with coworkers can be a challenge. We often feel frustrated because we get told little about new schedules and other changes. That is dangerous in a pandemic, when accurate information can literally save lives. Staffing has for a long time been too low. Frontline employees regularly open and close stations alone, early in the morning and late at night. And other workers work alone cleaning the stations, which is unsafe. Cleaners were already understaffed before this virus hit us. There's often only one worker responsible for the cleaning of 2 or 3 stations. And that level of staffing, coupled with the extra work of sanitizing that needs to be done now, has overwhelmed many. Also, the lack of protective gear has been a source of real concern. The ones that need personal protective equipment or PPE because of their regular job duties have seen supplies dwindle fast. Getting adequate supplies remains a struggle. Managers have been collecting Lysol from storerooms and have in fact made it more difficult for workers to access. In one department, workers were told that there were no face masks, but after pushing back, management passed out 1 mask per person. The scarcity of PPE created by the cost-saving strategies of BART managers has put those who are called essential employees at risk of infecting themselves and their loved ones. In the maintenance shop, management delayed responding to this crisis for fear of hurting productivity. But now that it's clear that service will be scaled back, they are readjusting shifts. They are taking steps to send large numbers of coworkers to new car training so that our incomes are not paid from the general fund or the general operating fund. They put up some hand sanitizing dispensers, some signs, some stickers on the floor indicating 6 feet. And only after the union steward pushed did they move daily briefings so that we could have more distance between each other. Also, coworkers have been slow to change their attitudes and habits. To this day, they're not keeping 6 feet apart. The work itself is organized to get things done and not always in the safest way. Moving heavy equipment and components can be impossible to do alone. And if workers would truly respect the 6 feet distance, some of the work would simply have to wait. People look to management and the union for a response, but there has not been an adequate response from either. In the absence of that, it's clear that we need to look to ourselves. That is why some of us have begun to discuss the problems we face via Zoom and conversations at work. The Zoom meetings are an effort to build connections across shops, stations, and departments. That doesn't happen often, especially since workers are spread throughout the system and we're in separate unions. The situation we're in has afforded opportunities like that, but it takes people to act on them. We don't know what lies ahead, but whatever we build today will be important for our future. This is not business as usual. If we're going to be working, we need mass testing and monitoring, adequate protection, and rigid rules on 6 feet distance at all times. That's non-negotiable. In New York City, more than 50 Metropolitan Transportation Authority workers already have died from the coronavirus. That's the price we will be paying if we don't act. I hope that some others on Zoom today who work at BART or other transit agencies can share how their jobs have been impacted by this public health crisis.
So my name is Sarah, and I'm a high school teacher and an activist in Oakland Public Schools. So I want to start with a phrase that we've heard over and over again in this crisis. When will it all go back to normal? And to that, I'd say there's only one real response. Let's not go back to normal, because normal is the problem. What does normal look like in Oakland schools? We have one counselor for every 550 students and just one nurse for every 1,600. There are virtually no librarians left. Art and music programs have been gutted. Schools in the poorest neighborhoods are highly segregated, under-resourced, and often run into the ground. Teachers are judged for how well they teach to the test, not for how well they teach creativity and critical thinking. Why would we ever want things to return to this so-called normal? Of course, things have only gotten worse during the crisis. Students and families who were barely getting by have lost their jobs, and now their cupboards are bare, the bills are piling up, and the rent is overdue. Students are afraid they'll go hungry, get kicked out of their apartments, and be left destitute and homeless. To give you some context from my job, I teach at a small continuation high school for newcomer students. Many of our students are undocumented and unaccompanied minors, and so they're often working 20, 30, 40 hours a week to support themselves. So in response to this crisis, every staff member at my school has essentially become a quasi-social worker. Some teachers have delivered food or money to students' doorsteps. Because of the failure of this system to provide pandemic pay to everyone, we have a GoFundMe set up to raise money for students, but it really is just a drop in the bucket. It's totally insufficient to meet students' needs. Sometimes all we can do is listen to whatever crisis they're facing. So I want to acknowledge that in the midst of all of this suffering, combined with social distancing, it's easy to feel hopeless and like nothing is possible. And I want to take some time now to give a few concrete examples of how teachers have moved forward with our organizing efforts during this crisis. So in our union, our schools are divided into 7 regional groups called clusters. During this time period, we've continued having cluster meetings via Zoom to try to bring people together across multiple school sites. The goal for us is to share what's happening at every single school that we're connected to, and then to decide collectively and democratically how to move forward. And I think that's really crucial. We have to empower the people around us to step up and act. At one of the first cluster meetings during this crisis, a teacher proposed the idea of doing digital town halls to bring together teachers and families. Instead of running the whole thing themselves, they reached out to a parent to lead the wellness portion of the meeting. The first town hall was small, but it's a start, and it's something that we can build on. That's an important part of what we want to do going forward. We don't want to be limited by artificial union boundaries. We want to organize everyone together, including families, students, non-teaching staff, and contract workers. To give a few more examples of how teachers have stayed connected, folks have been holding Zoom meetings with their school sites, as well as happy hours, Netflix parties, board game nights, and I know some folks in Richmond that had a social distancing spirit week. And as a side note, we actually have a Google Doc with all these ideas, as well as tips for running Zoom meetings. So if you post your email in the chat, I'm happy to send that to you. So currently, some of us are working on a newsletter written by teachers, students, and families. And the goal is to share our experiences, stay connected, and give an accurate picture from the ground up of what's happening to the community and the real impact of this crisis. Through this newsletter, we want to show not just all of the problems that we're facing, but also how people are staying connected, organizing, and fighting back. I think it's also important to say that during this crisis, the Oakland School Board wants to continue closing public schools and co-locating charter schools on public school campuses. So what does that mean? In a co-location, a charter school steals highly needed classrooms from a public school. And although we couldn't be together physically, we're all socially distanced, more than 6 feet apart, teachers still managed to organize a 3-day digital protest against the closures and against the co-locations. Families recorded videos that were posted online and spread across social media. Teachers, families, and community members called and emailed members of the charter school boards, the Oakland School Board, and local and state politicians to demand a halt to the closures and co-locations. During the board meeting, we flooded the meeting with written and verbal comments. So this whole time period, the calls and emails, they were made at a specific time each day, and that was called an hour of power. Members of the charter boards claimed they felt threatened by the onslaught of calls and emails, and the Oakland School Board announced it would postpone the next round of closures and reconsider the co-locations. This delay was a small triumph, but obviously it's only a pause in the attacks, not a promise to stop them. And in fact, they're still moving forward with this year's round of closures, a devastating decision for the teachers and students at those schools. Fights like these are a reminder that we can't sit around and wait for the next contract struggle to save us. We need to mobilize our entire membership now for the struggles ahead and link ourselves with families, students, non-teaching staff, and workers in other workplaces. When this pandemic is over, we're going to face a mortal struggle between the billionaires that run our society and the everyday people who make our society run. That means our organizing efforts must continue. So I want to say to everybody in the town hall now, if you're wondering what your role is in all of this, every single person here is vital in these efforts. If we use the time during this crisis to strengthen our networks, we can be better prepared to act collectively to fight for a different future. That's the task we all face in the coming time period. And I want to close it out with a saying from Rwanda. It's used whenever one politician is exchanged for the next, with no meaningful systemic change. The saying goes, "The dancers have changed, but the drums are the same." If there's one thing this crisis has made clear, it's that it's time to change the song. Or put another way, let's not go back to normal, because normal is the problem.